We're now joined by Acting HOD of Research and Policy at the Commission for Gender Equality, Naledi Selebano, and she joins us via our video link. Naledi, thank you so much for your time this evening here in SABC News. I mean, perhaps this sort of here, I mean, where are we getting it wrong as a society in terms of, allowing young mothers, to go back to school and get an education regardless of them being mothers?
Thank you, Mbali. Good evening to you and to your viewers. Let me start just by giving a little bit of context to the study. It was conducted in the 2022-2023 financial year, and what we sought to find were factors that influence teenage, young or pregnant learners, as well as those that are mothers, from returning to school. And what we found was that there were an interplay of factors. So not a single factor could be associated to this challenge. There were individual factors such as self-esteem. So in situations where the pregnant teen or the young mother feels that they're not sure of themselves, that they would be able to go back to school and be able to concentrate, learn, and adequately complete the academic year. So some felt that they were not motivated enough, especially now being faced with the situation of being a mother and also the responsibility of having to learn. Another factor that we found as the CGE was that issues of the socioeconomic status of the family. So when the teenage mother or the pregnant teen is unable to afford somebody to take care of the child, then they would not return back to school, especially where they come from families wherein their parents themselves have to go out and work in order to fend for the family. So in that instance, the young mother would have to then stay at home in order to take care of their child. Another important factor that was uncovered was on the school-related factors. So when the stigma in the school setting, whether by educators or fellow learners, then this would make it difficult for them to cope, and as a result, they would then fail to return back to school. There were also challenges around schools' practices themselves that served as barriers for teenagers to return to school, especially in situations whereby pregnant teens were expected to bring a guardian with them to school. And, in some instances, they were not able to, especially if their parents have to work or if they cannot afford to pay a community member to come and take care of them. And this was the situation mainly in the Eastern Cape, where we learned that this practice was prevalent. And, once the learner is at 7 months pregnant, they would not be allowed on school premises. However, we noted that this is against the national policy on the prevention and management of learner pregnancy. What the policy says is that at 8 months pregnant, the learner must produce evidence from a healthcare provider or a doctor that they could come back to school. And if not, then there's an intervention that must be put in place to ensure that when they return, they're able to be reintegrated into the system and be able to complete the academic year. So in a nutshell, these are some of the challenges that we found.
And it seems as if a lot of these challenges you're actually finding right in the school because of the stigma attached to being a young mother. What do you think can be done to highlight this awareness and, always give these girls hope of a second chance, that, it's still possible to complete your schooling?
One of the recommendations that we make is that schools must create a positive learning environment. And this, again, is already emphasized in the policy. Schools must ensure that they offer support, because a lot of times the stigma is towards the young girl, and yet they are not the sole person who's responsible for the pregnancy. And a number of times that spotlight is never cast on who the perpetrator is. It's usually on the young girl. but schools must create an environment in which learners can thrive. And once they find themselves in this situation, they shouldn't be scared to go back to school. In fact, a different scenario should take place. Schools should ensure that there are interventions such as remedial classes, that there are catch-up initiatives, because we've also learned that a number of times what leads to them or the pregnant and as well as young mothers not feeling confident to come back to school is because they feel like they are left behind, and schools do not provide that sort of platform for them to catch up, be on par with their peers, and be able to write exams if that's the case, and be able to complete. So schools must create a positive learning environment. Other learners in the school environment must be taught how to handle these situations, so that when it happens, then there's no stigma or discrimination that is leveled against the pregnant teens as well as young mothers.
And are schools coming to the party? Are they playing that meaningful role that you are saying that, they must create a conducive environment, especially for young mothers? Are they intervening in a way that they are supposed to?
So what our study found was that it was not seamless across the board. So in other areas, you'd find that schools have introduced systems in place to ensure that young learners who fall pregnant are able to come back, learn, and that there's a positive learning environment that is created. But in some situations, this was not the case. And so what we could also deduce from the findings of the study was that it seemed as if the learners were at the benevolence of the schools in terms of how the teachers are. If they're a positive teacher who's willing to listen and be empathetic and support the learner, this would be the case. But in areas where this is not the case, that the educators are supportive and able to empathize with the learners, then that would not be taking place. And I also must emphasize that issues of context must also be taken into consideration, in a sense that schools are not the same. You'd find that some are advanced in terms of resources. We also learned that the Department of Basic Education would deploy learner support agents that would be able to even identify challenges where they arise, psychosocial challenges that is, and be able to refer learners to social workers and psychologists where there was a need. But in other schools, you'd find that that resource was not there at all, and therefore learners would be left at the benevolence of the teachers. There were no systems in place to ensure that that's a situation, that there are interventions in place to ensure that the situation is managed very well. In the study, what we also uncovered was that teachers would also be fearful of handling pregnant learners. They would say in some instances that healthcare facilities are too far, and therefore if a learner experiences some emergency situation, then the teacher would have to be responsible to take their own vehicle and transport the learner to a facility, and they would feel that they would be unfair. Should anything happen, then the blame would be on them. Issues of ambulances not being able to reach far off rural areas and other circumstances. And that would push educators to feel that they're in a compromised situation because they would have to answer if anything went wrong. So circumstances were not the same. And this is because the context in which the schools we went to found themselves were different as well.
Naledi, thank you so much for your time and that insight. That is Naledi Selebano. She is the acting HOD of Research and Policy at the Commission for Gender Equality.